My name is Blaine Evans. I'm actually doing the interprofessional group video for Group 7 for the 831 Public Health class. The first thing that we were asked to discuss was actually the aspects of the information packet. Um, in terms of our problem that we were actually given the issue to address adolescent obesity in the country of Grenada, ages 10 to 19 years of age. The issue is that they have recently been actually introduced within the past couple of years sugary foods as well as highly processed sugary beverages and low in quality for nutritional wise. And they also have an issue of high sedentary lifestyle as well, causing childhood obesity, hypertension, diabetes, leading to later risk factors as well. Thoughts about it? I actually enjoyed this overall assignment in general. I did enjoy working with the people a lot. We actually came to the solution that we had a multiple prong approach in terms of what we wanted to do to create a lasting impact in terms of addressing the problem at hand. So the first thing that we did, we thought the lasting impact to address the problem would actually be changing the legislation. We saw that in multiple Caribbean countries and other countries as well. We saw through our research that we actually had positive results in terms of like countries increasing the tax on their sugary beverages as well as their just high sugar foods, candy, things like that would actually promote obesity. And they found that that was actually positive, and it helped actually reduce the obesity rates some in children as well. Another thing that we actually suggested it's a very similar thing that was done in Georgia. It's actually called the Fit Kid program, and it's similar in that in Grenada we actually don't want to do the after school like program, but Fit Kid was an after school program that was actually subsidized, and basically these professionals were educated on various types of activities that were highly aerobic, as well as stretching and things like that afterwards. It was broken down into 3 times a week, about 120 minutes total. The first 40 minutes were basically kind of like study time for the kids. And then it was 80-minute periods, not 120. The first 20 minutes were actually going to be just kind of like downtime for the kids to study some. The 40 minutes after that were actually the high intensity aerobic measures that were done. And then after that, the 20 minutes were just kind of cool down, some intensity, like in terms of resistance workouts, as well as stretching and just kind of cooling down as well. My experience overall, like working with the team, in the interprofessional setting, I had both mixed reviews for it personally. I enjoyed working with many of the group members that I had within the group itself. Despite all of us being very busy individuals, I did appreciate the open nature of the conversations that we were having in terms of just keeping communication to an open dialogue and being respectful in a manner. I always thought that was good. I did think that some of the group members, however, there were some of them that actually did absolutely nothing at all on this assignment, and I think it required some of us as group members to actually increase our workload. Which, yeah, that's part of the issue at hand. But I think that they pretty much just didn't even try to contact us at all or help us in any way possible. That was one issue. Another issue but I think for the most part we addressed this issue, was just like kind of trying to coordinate times. I think we were really good about coordinating times to work on things together. And I think overall just trying to get task oriented, I think was really good. I thought just helping one another with the assignment and assigning tasks was really helpful in getting organized and just being efficient on how things were getting done. Thank you so much. That was my experience.